I'm a 24-year-old complete C6 quadriplegic. My end goal for working with the OT is to be able to independently grocery shop. I do not have any use of my triceps, and I have pretty good use of my biceps. I can lift my arms like this. If I put my arms here, they fall because of my triceps being paralyzed. I can use my tenodesis grip like this to hook my thumbs on things and to sort of stabilize grabbing items from shelves. And those are the techniques I'm going to be using today.
So now I want you to tell me how you're going to get into the store.
Okay, well, you have to make sure we parked in a handicap spot where there's enough room for my car ramp to come out. And then I have to make sure that I cross at the crosswalk over here. And I have to make sure that the wheelchair accessible entrance onto the sidewalk, which this one does. And then I need to make sure that there are automatic doors to enter into the store.
Tell me, how would you get the baskets?
Well, last treatment session you taught me to hook my arm into one of the arms of the basket and then bring it onto my lap. But these ones are taller than the ones before.
What do you think you would do? You have any ideas?
Still try to do it the way you taught me, or ask someone to help.
Yes, that's a great idea. Next session we'll go over different ways to approach people and ask them to help. But today I'll just be your helper.
Okay.
So I'll hand you the basket.
Okay. First thing on my list is candy.
Okay. How's it going?
I can't reach it.
How do you think would be a better way to do this? It's safer.
Maybe if I came on the side.
Yes, why don't you try turning your chair so you're more parallel with the shelves. Very nice. Now when you're reaching, go ahead, put it in. When you're reaching for safety, hook your arm back so that you don't...
Like this?
As you pull it forward to get it closer to yourself.
Okay.
And then when it's closer, then you can reach over with the other arm and bring it over into your basket. There you go. What's the next item on your list?
I usually get bread rolls.
Bread rolls?
Yeah. At this store, they're kind of high up, so I can't reach it. So I guess since you told me to ask for help with the basket, I should ask for help to get these too.
Correct. Why don't you demonstrate an idea of what you might say to me?
Would you mind getting the bread rolls on this top shelf for me? I can't reach it.
I would love to. Here you go.
Just put them in here. Thank you.
You're welcome. Okay, that was very good that you hooked your arm, but what do you think would be a little bit better, a little more safer to do?
I guess if I make sure that I'm right next to here.
Yes. Can you show me how you do that?
Yeah, I was trying to save time, so I wasn't being as detail-oriented, but I should make sure I'm right next to the edge.
Your safety is more important than the time. Very good. Remember you mentioned opening doors like these is hard, so I'm going to show you a technique today that then we'll practice using. So what you're going to do is with your thumb, you're going to park up parallel next to the chair. You're going to, with your thumb, hook it on to the bar of the door, pull it open, As you juice it open, you're going to swing your elbow back to then open the door, and then using your chair, you're going to roll back to hold the door open. Then, as you're close enough, you can then use your grips to get the package out and into your basket. Does that make sense?
Yep.
Okay.
I want you to give it a try.
Okay.
Very good. Some patients will use the chair to push the door back.
Okay.
That's helpful.
And I didn't hook my arm, but I was close enough that I didn't feel like I had to.
That's correct. I still think you were very safe in that. Well
Okay.
done.
Good. That's okay. You just want to be really careful with when you're placing things into your basket. You want to make sure everything's rearranged before you pick something heavy like this up so that it doesn't tip. It's just a little proactive thinking to make sure you're thinking ahead and having things placed out so that everything is level and even.
Okay, so I should make a spot for it and then put it on where the weight would be distributed.
Yes, exactly. That looks
Okay.
perfect.
Okay. Like this.
How's it feel now?
Feels a lot better. I can turn down aisles and I'm not scared I'm gonna lose things because everything's distributed really well.
Good, I'm glad.
This Friday, November 20th, for our fantastic Friday sale. On Friday from 9 a.m. to 9 p.m., you'll find great half-price deals on family packed chicken tenders, fresh pork tenderloin, beef and wonton American cheese, selected gold fruit, and more. Southern red king crab clusters will be on sale for just $7.99 a pound. These and other great deals are available from 9 a.m. to 9 p.m. on Friday, November 20th.
That felt a little unsafe.
We'll see you Friday.
You're doing a very good job of problem solving as you go.
There's this lip on the shelf and I can't slide the box off. So I have to make sure I get really close so I can reach it.
Very good. Good, I like how you're thinking ahead, planning for where you're going to place the milk.
Yeah, milk's a big item.
It is.
Alright, I got a spot.
Good, you're getting nice and close. Very good hooking your arm. That was very smooth, very well done.
Great job today. You did a wonderful job coming into the store. You were totally and 100% independent. Very proud of that. Definitely seeing progress on our